We have a question from Angela McGilvray.
Oh, come on.
As a registered nurse and a mother of a child who was diagnosed with childhood cancer, I feel I have seen Queensland Health from both sides of the fence. We, the Queensland public, were reassured that frontline staff would not be affected by the cutbacks. Now, as an oncology nurse giving chemotherapy to we are seeing services being reduced. Frontline staff are stretched to breaking point. Is it going to take a catastrophe before the government sees the importance of quality healthcare for everyone?
Okay. So let's just pause so we can actually hear the answers. Tim Nichols.
Sure. The delivery... Well, actually, firstly, I was going to say I'm sorry to hear about your personal circumstances. And of course, my heart goes out to you in terms of that. And thank you for the services that you do as well, because they're not easy services to deliver. So I thank you for that. In terms of the delivery of those services have been cut back this year. There are a couple of reasons for it. One is predominantly $103 million was withdrawn from the Queensland Health Service by the federal government changing their payment rules. They required a repayment of $40 million that they had already paid to us, and they cancelled a payment of $60 million that was coming to us. So that necessitated, towards the end of last year, some very significant changes that we unfortunately had to do because the money wasn't coming through. I should also say that this government, in its first year, increased the funding to the health department and the health services by $800 million, from $11 billion to $11.8 billion. And that included a resolution and a settlement of the outstanding nurses' claim for the nurses' payroll, for the nurses' wages and so on, that was resolved within 3 weeks of us coming to government, where we came to a settled outcome. In terms of the delivery of services, health and hospital network services, which have been put up jointly by the state and federal governments as part of the health delivery system, the reforms that were agreed between the former government and the federal government are continuing to be implemented and delivered out there. And we remain acutely conscious of the need to continue to provide additional funding, like the extra $800 million that we provided this year.
I was going to bring you quickly to one of the key points there. Frontline services stretched to breaking point is the allegation from the front line, I think it's fair to say. Would you agree, Angela? You've heard the answer here. What do you say?
Why are there frontline staff that have been sacked? It was not supposed to happen, and the hospitals are just unbelievable. It is unbelievable.
Look, I agree, and as I say, we wouldn't have wanted that to happen. But the reality is, not of our making. In December last year, the government was required to repay $103 million back to the federal government that had already been either expended or about to be expended. We put an extra $800 million into the system, another 7% increase over the previous year's system, and in doing so, we've also implemented the health and hospital network system. We've put an extra $50 million into regional and rural health networks to upgrade hospitals that we found hadn't been properly maintained on the way through. And we've introduced things like Mums and Bubs system, another $30 million program to assist new mothers with their children.
Okay.
Let me finish, because more work certainly needs to be done, and it's not the end of the story, and I appreciate exactly what you're saying.
Let's go quickly back to Angela. Are you happy with the answer you're getting?
Not really, because I see the everyday reality of it.
Tony, please, can we not give Tim another go?
Just let me say, since
you can't.
No, Bob, hang on. So, Bob, I'm afraid democracy is about everyone having a go. And Jed Carney hasn't had a go. I'd like to hear Jed Carney on this.
Is that okay, Bob?
No,
Jed, go ahead.
Be my guest.
I was in Cairns recently for May Day, and we had one of the biggest May Day marches we've had in Cairns, and I was really proud to walk along with my nurses from my union, and a couple of them there said that they had got the dreaded white letter, is what they said, and it was probably the last day that they'd be able to march in their uniforms. And it goes back to the short-term question of the gentleman before. to cut such significant jobs like nursing jobs and health jobs not only has a huge impact on the health system, but it has an enormous impact on those small regional communities. It decreases their buying power. It affects the small businesses in those towns. It has a terrible impact. And I just want to say that I think, you know, for all your argy-bargy about the budget and everything that you had to pay back today, I think it boils down to a basic question that there is an ideological issue here where, you know, Liberal governments do not believe that there is a role for government to provide public services, and I believe that you are actually cutting back public services.
Okay, you deserve a right to reply to that. Keep it brief because I want to hear from the other panellists.
No, that's totally wrong. We totally believe that there's a role for government. There is a total role for government in ensuring that services are delivered to the public, that we can grow those services, we can improve those services, and we have to do that sustainably into the future, and that's what we believe needs to be done.
Okay, now I'll go to Larissa and hear from the other side of the panel.
Thanks. Look, I think it's a bit disingenuous to say that you want to somehow improve the health system when you start by cutting 14,000 public sector workers. Including those that are on the front line. Now, I mean, health is absolutely vital to everyone here, and I'm afraid you've used this Costello report and some confected budget crisis to try and remove that essential support for people. And in the response last week, where you're now mooting, selling off and privatising the services that those hospitals provide, then you're going to make the system even worse, and it's really going to hurt people. So I'd really urge you to rethink. You've heard a really strong sentiment tonight, and one very powerful example from Angela. I'm sure there's many more examples, sadly, like that.
Let me correct you. Firstly, we aren't moving off the sale. We're not talking about... It's important that I correct you. We're not proposing the sale of health system of the hospitals.
No, I didn't say that, Tim. I know you're not proposing that. The services that they provide.
And in fact, many services are already provided by other people who are not Queensland Health. And I've said this before. If you go to the Mater Hospital, you will be treated by employees of the Mater Health Services who will be being paid for by Queensland Health. If you go to the Greenslopes Hospital, you will be treated by people who are employees of Ramsay Healthcare who are paid for by Queensland Health.
Well, I like to go to the public hospital and get good health care.
If you go to the Noosa Hospital, but you'll go to all of those hospitals and get the health care that is necessary and is appropriate for you. And there has been no complaints that I'm aware of in relation to the Mater Health Services or Greenslopes or Noosa or many of the other services that are provided.
I've got a complaint. Huh?
Yes, go ahead.
I've got a complaint. Since 1944 in this state, the state government funded 100% health services before we had Medicare, Medibank, whatever you want to call it. It was a state government responsibility for the people of this state. To say the Commonwealth government has cut your funding, who cares less? It's a state government responsibility and they should meet that obligation. Secondly, I just want to tell you something. Our party will stand candidates at every state seat in this state, and we'll make a public announcement in Parliament when it resumes that if they sell any hospitals, if they sell any schools, that we'll resume them as soon as we're elected without compensation. So if you're smart enough, buy them and see what happens.
Okay, we've got a question.